here today and to be with all of you. And I really have to say, and I put a big emphasis on what we're hearing from Erwin and from Hannah, and the emphasis on listening. And just to tell you what I was asked to speak about, it was to address the developmental challenges of children exposed to trauma early and or later in life, and how do I understand that? And let me first be clear, I work with an amazing team of people, so it's never about me, it's about a team. And both in health and with my colleagues in child protection, it truly is understanding together. And the second question I was asked to address is, how can the system, no small task here, mental health, child welfare, physicians reduce the burden of suffering by adhering to the principle of keeping children at the center of decision making and honoring their right to truth and voice? So that's what I've been asked to cover. And I would just invite you to join with me, because I think it's going to take all of us to figure this out. And I was just so moved by what Hannah and Erwin had to say this morning. I want to talk about the issue of the children's voice in healthcare. And I think it really is about listening and observing. And I think we have to understand more about where children are at developmentally. And so I'm really going to advocate for us making that a priority also in our education. So I want you to stop for a moment. Those of you who are either in the past or currently working clinically, and ask yourself, in your training, how much did you learn about listening to children across the developmental stages? How much did you get observed interacting with children? So I'm not going to ask people to put up their hands, but I can tell you that as somebody who had a lot of really wonderful mentors, including Paul Steinhauer and Dan Offord, whom others may have heard of, the emphasis on learning how to be with children got very little time. And I see some people nodding here. So one of my main points is, I think we've got to change the system. We have to put the emphasis on understanding children across the lifespan. I'm not talking about being able to say, when should a child first walk? When should they say their first word? I'm talking about, how do we learn to actually engage with children? So let me give you an example. Again, thinking from your own perspective, many of you are likely parents. When you take a child, or say you accompany a child who's in foster care, when you take that child to see a nurse or a physician, how often is the child asked questions in front of the adult? How often is that child seen individually? You know, I can summarize really what I want to say here. I was going to use 3 words, and I'm now changing one of the words. I was going to say to you, it's all about talk, trust, and time. But it's really about listen, trust, and time. And our system needs work. And now I'm coming from the perspective of a physician And I want to say I've learned so much from my colleagues in child protection, because I think more than other groups, you do a lot of work meeting with children individually and hearing their voices. But I would say to you, we need to think more broadly about how we understand children's voices. And I would say in healthcare, we put way too much emphasis on the physical. It's not just about the physical. I have an expression which sometimes gets me in trouble because, a lot of times physicians are asked, could you do the physical exam? Could you just get in there and do the physical exam? And I say to people, it's not just about counting the bruises. It's about understanding children's lives. And how do we do that? I think we really need to take a step back and look at how do any of us become competent. Part of that is hearing exactly what we heard today from Erwin and Hannah and other young people. But we also need to hear the voices of those who developmentally, as you heard earlier from Erwin, are starting very early on. So again, it's not just about standard growth and development, it's understanding, reaching out, hearing from others. So not only the child, who is hugely important and should be at the center, but it's taking the time to hear from a lot of other people who are involved with that child. And that's very much what colleagues and I have tried to do through the Child Advocacy and Assessment Program where I work. I want to take a moment and talk to you about research. So on the surface, I've tried to give you some hopefully practical examples in the area of education. Research sometimes gets a bad reputation. People say, we don't have time for research, we got to get on, we got to figure it out now. But we also need to open our minds to what research is. Research is about hearing voices. It's about hearing from many, many different individuals, including children. And increasingly, there are ways of really making sure that we hear from children directly. I want to say that I had the privilege of serving on the child protection panel that looked at the legislation back in the late 1990s. And one of the things we advocated for was research. How are we going to know if the changes in the legislation actually make any difference? We said on that panel, the ministry has got to set aside funds for research. Now people may say, why research? We need services. That's where we need the emphasis. But isn't this area just as important as anything else that affects the lives of our children? Why are you hearing so much about the treatment of asthma or concussion? You're hearing about that in the news, big resources invested in that area. What about understanding the extent to which changes in policy actually improve the lives of children in care, involved with the child welfare system? So I believe firmly we need to really open ourselves up and say, we need to measure this. Now, Erwin referred to that, and time again, we make this case to provincial, territorial, and federal governments. I think we are seeing progress. And I'll just, in the last minute or so, I'll just check in. How much time do I have? 22 seconds. Okay. Well, Marv, I can steal some of your time, right? I just want to tell you, and you can go online, and if you just Google Project Vega, we have a project supported by the Public Health Agency of Canada. VEGA stands for Violence, Evidence, Guidance, Action. And we're together with young people, together with 22 organizations across Canada, including the Child Welfare League of Canada, we are developing guidance and evidence-based curricula on how to respond to family violence. And we're calling it Recognizing and Responding Safely. Because no longer should any healthcare provider be in the position of saying, that's not my concern. I don't want to get involved with anything legal. Because our children, as you heard from Hannah, are too important. Thank you.